Hi guys, welcome back to our channel. I'm Henal Somji.
And I'm Dr. Somji.
Today we're going to discuss an interesting topic that many expectant mothers may be encountering during their pregnancy journey. I know I'm certainly going through this right now. I've come up with quite a few freckles on my cheek after my holiday. So we're going to discuss pregnancy mask, also known as melasma or chlamydia. So let's dive right in. So I'm going to ask you a series of questions and you're going to be kind enough to give us the answers. First off, what exactly is pregnancy mask?
So melasma or chlamydia, as it's known, is a common skin condition that can occur during pregnancy. It tends to be characterized by dark, irregular patches on the face. So most of the time you can find it around this sort of cheek area. Found on the forehead, upper lip, chin area. You can also get this more pigmentation in different areas, so you can get that line coming down from the pubic area in the linear region, and that I know that in previous pregnancies you've had that.
Yeah.
Certain genitalia, so your nipples can get a little bit darker, as well as the areas within the pubic area can become a bit darker as well. So yeah, these are things that you unfortunately get during pregnancy. Everyone has to embrace it. I think
Great
that's
perks of being a woman.
No, I think it's kind of nice, a proud thing really. Like you should always embrace pregnancy, but obviously once pregnancy finishes, you want to kind of get rid of it.
Of course. So what causes this condition? Why during pregnancy?
Well, we know what causes this condition. It tends to be that you've got more hormones when you're actually pregnant. So your levels of estrogen and progesterone are really high. And we know this because in certain patients that actually take the oral contraceptive, particularly the combined oral contraceptive, they end up with pigmentation. They can end up with melasma. And sometimes just stopping that can also treat the condition. And in pregnancy, you've got a natural increased level of these things. And those hormonal shifts stimulate the production of melanin, which is the pigmentation within your skin. The melanocytes are the cells that stimulate pigment within your skin, and this is stimulated. So this stimulates the production of dark patches. We know that in these areas, the cheek areas, in the areas that tend to be more sun exposed, the highest points of your face, they've probably been damaged by UV beforehand.
Previously, yeah.
So if you use something called a Wood's lamp prior to pregnancy, you can probably see these areas of pigmentation beforehand. And that can probably, if you see that and there's a positive sign on that analysis, then you're probably a little bit more at risk than the average person for actually getting it. It's more common with patients that have darker skin types. So it can be genetic. So we know that your mum has melasma. We have treated her melasma a few times.
Yes.
And also the other people that are risk, like we said, people that are sun worshippers. So if you love sun beforehand, you're going to have that existing UV damage and increased in melanocyte activity, causing more melanin and therefore more pigmentation. So you can be one step ahead by getting an analysis before pregnancy to see if you're at risk. So melasma generally develops in the second or third trimesters, where the levels of estrogen and progesterone are a lot higher. So these tend to be, it doesn't happen normally within the first trimester. It kind of catches you out a little bit in the second and third trimester, and you're in the third trimester.
Well, yeah,
now.
I'm literally coming into my third trimester, which probably, explains why I've all of a sudden...
And we've just been on holiday as well, right? So there we go.
Right, are there any risks to getting this? Is it easy to get rid of it?
There's no risk in terms of your actual health risks to mother or baby. It's more of a cosmetic concern, and it usually fades on its own after pregnancy. I generally say to most patients that untreated, if it's just mild melasma in that area, it'll probably take about 6 to 12 months to generally fade. But there are definitely things that you can do, and we're going to go through some strategies as well.
So what are some ways to prevent getting a pregnancy mask, obviously apart from the common wearing SPF?
Yeah, that's the first thing. So that's the first tip that you really want to be saying to most patients is protect yourself. So exposure to sun is going to make that pregnancy mask a lot more pronounced. So wearing broad spectrum SPF with an SPF of 30 or higher on your face all day, but you should be doing that anyway.
Yeah.
And especially if you're outside, you want to be reapplying as well.
Yeah, I was going to say, I mean, would you generally top it up a lot more than you would if you weren't pregnant?
Well, I think this is a practice that you should have anyway, right? So I think that, yes, probably every hour in sun, you need to be topping it up. And there's some great spray SPFs that you can use that can just help top up the protection.
And what do you think about like the makeup that you get from like Abaji, for example, where they've got the brush with the SPF in there to top it up?
Yeah, I think that's quite nice.
It's quite effective.
Yeah, and
yeah.
That's really quite good. I know you use that one, right?
Well, I have used it in the past, but I guess I didn't religiously use it, so...
Yeah. One thing I didn't notice you doing on holiday was actually wearing a hat. So you normally have loads of hats.
I didn't.
But I think you left that at home. So wearing a wide brim hat and making sure that you're just getting complete block of the sun is really important. So the second thing is during pregnancy, you can use a topical vitamin C. It's a really nice, powerful antioxidant that just helps brighten melasma. It also slows down melanocyte activity. So that activity, if it's reduced, then you're going to have a reduced chance of developing melasma, and it will also kind of like, let's say, treat it at the same time. Vitamin C is that sort of superstar ingredient that we've gone through on this channel on numerous times. There's many benefits for like redness, pigmentation, even anti-aging, can help stimulate collagen production, and it's safe during pregnancy as well as breastfeeding as well.
And it gives you a nice glow.
Yeah. So the third thing, you know, this is my favorite ingredient in pregnancy and just generally for every patient, is the use of azelaic acid. Azelaic acid's been shown in clinical studies to be safe during pregnancy, so you can definitely use it at both 15% and 20% for best results. And you know, it's really important to use azelaic acid because obviously most skin lightening ingredients, things like hydroquinone, even things like retinoic acid, so the retinols, tend to be off limits. Now, retinol is a bit confusing whether it's on limits or off limits, but I will just say that, you know, you really don't want to really take so many risks during pregnancy, and we know that azelaic acid's safe because obviously, yes, it helps with the redness, but it also will help with pigmentation as well. So it can treat that. And also in pregnancy, you can get some acne as well.
Yes.
So azelaic acid will help that too. So it's that superstar ingredient that you can use that will just protect your skin over time. If you don't have access to like kind of prescriptive azelaic acid at 15 and 20%, then Paula's Choice do a nice one. I think it's like 10 and 15% that you can use. And they're normally available as like kind of creams or gels, which are really quite nice.
Which treatments can we have after having the baby? And after breastfeeding, obviously.
Yeah, so I mean the key is with breastfeeding actually, because that's really important. So you need to know in advance what you're doing in terms of breastfeeding. Some people only breastfeed for a short period of time, some for a little bit longer. So you really want to be careful about what you're using. Continuing the vitamin C, the azelaic acid is really important. There are some clinical studies to show that alpha-arbutin, which is a glycosylated form of hydroquinone, can actually be quite useful. So you can use that sparingly during the pregnancy as well. And the Ordinary do some great alpha-arbutin, which is great. But then afterwards, you really want to be doing something that's, let's say, a little bit more aggressive for melasma. So the first thing is laser treatments. So Q-switch Nd:YAG is fantastic. So you can get some, it essentially shatters the pigment.
Yes.
And it's great for clearing up pigmentation. So pico lasers, so very quick lasers that just flash and break down the skin, break down the pigmentation within the skin. Your body naturally gets rid of it as well. We find in the clinic that a great treatment for getting that deeper pigmentation out of it is the Cosmelan treatment, which is a natural blend of things like vitamin C, alpha-arbutin, kojic acid, as well as retinol. It's a treatment that you can do within clinic. It's a mask that's applied over the face.
Yeah, it's literally like magic.
Yeah, and I will say this, in terms of cosmetic appearance, it gets rid of probably like 80-90% of even stubborn melasma, which is really good. Other strategies that you can do in terms of medicinal forms, sometimes I like prescribing tranexamic acid, and that helps quickly resolve melasma over time, so it's tablet form. We know tranexamic acid can be used for individuals that have heavy periods, for instance, but it's also approved for reduction of pigmentation as well. So that's a kind of a boost that you can do. But it's really important to know that if you're clinically diagnosed with melasma, you can't cure it.
Yes.
So you can get rid of the cosmetic concern, but then you still have to maintain it. And what we go back to the original things that we talked about. SPF, using daily vitamin C, using retinols, and maybe using a very mild skin lightening agent as well.
So when you're diagnosed with it, does that just mean that you'll just creep up with it again and again if you don't keep on top of it?
Absolutely. So I think that when a patient comes in with melasma, I normally say, look, this is going to be a long relationship. We can definitely get rid of kind of flares that you might have with kind of lasers and chemical peels, but you have to be doing the right thing at home as well.
Yes, of course.
So I always say, look, my job is to find the most economic and least time-consuming way to control your melasma. Whether that be just doing a few short chemical peels throughout the year, whether that be a few kind of laser treatments and really like high protection during the summer months, we need to find what's right for you. So in summary, look, prevention is better than cure. So definitely the most important thing that I want you guys to take is the UV. There's some like SPF, like 120s that you can get from a company called Meso Aesthetic, which is really, really nice. If you've got aggressive melasma, you might need medicinal forms, you might need oral tablets as well to help clear it up. And using a mixture of lasers and chemical peels can be really quite nice to really service what you need in terms of cosmetic concerns with melasma. It's not a harmful condition, and most of it fades as the hormone levels go down as well. But like I said, it's always about getting the right assessment, getting the right diagnosis, and then seeing an appropriate professional to get a proper plan.
Thank you for joining us today, guys, and I hope that was beneficial for you. That's a wrap from us. So if you like what you see, then please comment and subscribe. And if you have any questions, then please leave them below.